Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have three types of beta receptors: beta 1, beta 2 and beta 3. Beta 1 is present in heart and it is present in JJ cells of the kidney, whereas B2 receptors are present on the bronchi, they are present on the blood vessels, then uterus, liver, GIT, and they are also present on urinary tract and in the eye. Beta 3 is present in adipose tissue, bladder, and it is seen in the coronary arteries. Then the agonist of the beta 1 receptor is dobutamine, agonist of beta 2 receptor is salbutamol, and terbutaline are the agonist of beta 2 receptor. Agonist of beta 3 receptor is mirabegron, is the agonist of beta 3 receptors. Then this is agonist. Then we have antagonist. Antagonist of beta 1 receptor is metoprolol, and atenolol is the antagonist of beta 1 receptor, whereas the antagonist of beta 2 receptor are butoxamine, and alpha methyl propanolol is an antagonist of beta 2 receptors, and cyanopindol is an cyanopindolol is an antagonist of beta 3 receptors. Action of noradrenaline on beta 1 receptor, there is moderate action, whereas weak action of noradrenaline on beta 2 receptors, and there is strong action of noradrenaline on beta 2 receptors.
thank you and thank you for watching.